But okay, here we go. Welcome everyone to day 2 of Go Virtual Career Pathways Conference. I'm Sonia Lira with the San Diego County Office of Education. This is our Building a TB Peer Educator Program in a Health Pathway School session. I'm going to hand it over to our speakers, Marty and Yolanda. But real quick, we're going to wrap up today with Q&A, so save your questions to the end. And then we have an evaluation as well as a certificate for all the attendees. So go ahead, Marty.
All right, thank you so much, Sonia. And yes, my name is Marty Brentnall, and I'm the Outreach and Education Coordinator for the County of San Diego TB Control and Refugee Health Branch. And with me today is my colleague, Yolanda Lopez, and she is also part of the Outreach and Education team. And today we're going to talk about building a tuberculosis, a peer educator program in a health pathway school. As far as our objectives for today, we'd like to introduce or maybe reintroduce you to TB and the importance of eliminating it. Also, we want to provide you an overview of TB in San Diego County. And then we want to introduce the TB Peer Educator Program and how it would benefit your students in your health pathway program, as well as San Diego as a whole at San Diego County. To start off with, let me just go over briefly about tuberculosis. It's still here in the United States. A lot of people think it's been eradicated or that it's not a common disease, but it is still here in the United States. And I'll go over some statistics with you on how it impacts San Diego County. As you most know, tuberculosis is a communicable disease. It's bacteria usually finds its place when a bacteria enters a person's body, a TB bacterium. It usually finds its place in the lungs because it's a large, moist organ and a place for it to hide out. But it can also attack any other part of the body, such as the kidney, the spine, or the brain. TB bacteria spreads through the air, on only the air, from one person to another when a person with TB disease in their lung coughs, speaks, or sings. Also, active TB has an high associated mortality of approximately 10%. So it can really debilitate a person when they are sick. And then those that have been affected but are not sick could have latent TB infection. We'll go into that a little bit more, but that's what makes TB so interesting. You can be exposed to TB, but it can be in one of two forms in your body. It can either be sleeping or latent TB, or it can be active TB. And then people with that latent TB infection can become sick with active TB in the future if not treated. As far as the case for TB prevention, TB impacts lives. The same story can go over and over again. Anywhere from the 1800s to now, it definitely impacts people's lives in many different ways. We now have medications to cure the TB, to cure the active TB disease, but the impacts are still, for one, death. 1 in 6 die within 5 years of diagnosis. And also 10% who are diagnosed with active TB disease do not survive treatment. The treatment can be pretty harsh. It can also, impacts with disability. After treatment, people have less lung function and also a shorter life expectancy. And then more than 80% of children that get TB meningitis, TB in the spine or in the brain, die or are permanently disabled. There's also hospitalization. TB disrupts lives. Half of those that are with TB are hospitalized at one point or the other. And then TB hospitalizations are 2 times more expensive and 4 times more longer than hospitalizations for other conditions. A lot of our people with infectious or active TB disease in the hospital have other compounding illnesses as well, and they do tend to stay in the hospital for a long time. And then there's also the cost. It is catastrophic for patients and their families. Not only the cost of hospitals and the long hospital stays, but also in the loss of income while they're in the hospital or while they can't work. Especially if you're in a public-facing job, you cannot go back to work until your active TB disease is cured. And then, of course, it costs more than $180 million in direct and societal costs in California alone. And that was just estimated in just this last year. So the impact is great. But the great news is that TB is preventable, and prevention is less costly than TB treatment. And for an example, to be able to be treated for TB, the cost is $800 versus, for latent TB, it's $800 versus the $44,000 that it could cost for someone with active TB disease. Just to show you a little bit more of the impact of TB, I have this very short video. It's an hour, very short. It's a minute and 30 seconds. But this is one of our TB survivors, and she's sharing her story when she had TB. And not only did she have active TB disease, but she had multi-drug resistant active TB disease, which is about anywhere from a year to 2 years of treatment. So here's her story.
When I found out I had tuberculosis, I had my daughter right next to me. She was 1 year. I just started hugging her and crying.
You remember Mama being sicky?
I contracted tuberculosis in Chiapas, Mexico through a family member. I was taking treatment in Mexico. I was taking the first regimen. When I came to San Diego, I went to the hospital. I started coughing up blood. They started doing tests on me. That's when I found out not only did I have tuberculosis, but I had multi-drug resistant tuberculosis. And I started my regimen of pills on pills and injections. Before I finished my long, almost 2-year treatment, I found out I was pregnant. And the first thought in my mind was about my baby. Was he or she gonna be healthy? I was worried, but I stuck through. It is very important to get tested for tuberculosis. Without getting the right medication you need, you can also get multi-drug resistant, like it did to me. TB stops with me. When I found
All right, so that's Crystal's story and how it impacted her. So we talk about tuberculosis, and then we talk about the communicable disease that we all are very well aware of, and that's COVID-19. And they have there are many similarities to it, and there are many, and also have many of the same challenges. So both COVID-19 and TB are communicable diseases that can cause a major disruption in a person's life as well as their families. Some populations are vulnerable to the disease, more vulnerable to the disease than others. And there are many misconceptions about both diseases. These misconceptions can cause many challenges with delivering accurate information that can prevent the disease. And then both diseases need community support to overcome these challenges. And just one of the challenges that we have, and as I had spoke about earlier, is the fact that when you are exposed to TB and you have a positive TB test, and that means TB bacterium or TB bacteria is living in your body. And it can be in one of two forms. It can be in latent tuberculosis, in TB infection as far as latent, or it can be active as far as TB disease. And if in the lungs, it could be active infectious TB disease. And this is really hard for people to understand, because when we tell people that they have a positive TB test, we know the skin test, some of you might know the blood test. When a positive test comes back, people are in disbelief because they feel fine. They're not coughing up blood. They're not sick. And that's what people think of when we think of TB. We think of that active disease, that infectious disease. But actually, people can be fine and living with TB in their body and not know it. And just an example of the difference between latent TB infection and active TB disease. With latent TB, if we look at the column to our left, people have no symptoms. They don't feel sick. They can't spread germs to others. And then but there is treatment that you can take to prevent the disease from becoming active. So that's the great news. And then in comparing it to a person with active TB disease, they do have symptoms. They feel sick. They could be coughing up blood. They can spread the germs to others. And then they have to take the treatment to stop the TB disease, which can be anywhere from 6 months to a year of treatment. Whereas the treatment for latent TB infection can be only 3 to 4 months. Let's talk a little bit about San Diego TB in San Diego County. San Diego County has a population of 3.3 million. As far as an annual number of active TB cases, over the average over the last 4 years, that is between 2016 and 2020, has been 236 cases each year, the average. But that may seem small, especially when you think about COVID and other communicable diseases. But actually, when you think about the 236, you also have to think about the people that have been exposed to those 236 people. Again, when you're exposed to TB, you do have that risk of having latent TB, of having the TB germ in your body in a latent form. When we talk about that latent form with latent TB infection, there's an estimated 175,000 people living in San Diego County with LTBI. At least 80% of those people do not know that they actually have LTBI in their body. So these are the people that we're trying to do outreach to educate and to get tested. And so people know their TB status. When you think about that 175,000, that's equivalent to the population of the city of Escondido. That doesn't mean everybody in Escondido has latent TB, but you think about the population. If you know Escondido, or you think about the size of Escondido, think about that population all having latent TB infection. That's 175,000 people. Also, in continuing, just very quickly, we'll look at some of our statistics regarding TB, and these statistics are from the year last year. And so, as far as birth country, you'll see that it's spread out between Mexico, the Philippines, and the United States. But we also have Vietnam and then other countries. And those other countries can include former republics of Russia, countries in Africa and South America, Central America. So those are, and a lot of those countries have refugees or immigrants that live here in the United States. And being so close to the border, that also includes our binational population of both people that were born in the United States and living in Mexico, or born in Mexico and living in the United States. So we do have a larger population, and with that comes a higher risk of tuberculosis. As far as age groups, when you think about if you're a high school teacher and you think about your high school students, as you can see, we're starting from less than 15 years. It's 4%, but as you see, it progressively increases. We have had many cases in high schools, TB, middle schools as well. It's always sad to me when I see a young person in our TB clinic with wearing a mask and knowing that they're there to be treated for TB. So it's really important, and where we see this program that Yolanda is going to be introducing, it's really important that we start our education young about tuberculosis. And as you see, as they get older, the population increases as far as those that could have LTBI in their body and break down into active TB disease. Also, if you look at our county map, we call this our hotspot map, and these are our incidence rates for the years between 2017 and 2019. And as you can see, the area, and these are by zip codes, the areas in the red are our highest our incidence rates of TB. And that can, as you see, it's along the border into Chula Vista. Then you have Southeast San Diego, City Heights, going into the central San Diego, city of San Diego. This right here is actually where our TB clinic is located. And then you also have Mira Mesa, and this is a portion of Oceanside. But as you can see, we do have areas that we want to concentrate on our outreach for TB education. So we as a county are working with health organizations and nonprofits to eliminate TB. And we do have an initiative going on right now called the San Diego County TB Elimination Initiative. And it is a collaborative approach. And it's a public-private partnership, and it was launched in January 2020. And the goal is to build a coordinated tuberculosis elimination framework, and that supports effective TB prevention. And that includes risk assessments, doing risk assessments, testing and treatment of latent tuberculosis infection, so we can interrupt the progression of active TB disease. And we have more than 30 entities involved, non-county entities involved in our TB elimination initiative. That includes 35 non-county participants. And as you can see, that includes the San Diego County Office of Education. We have the Community College District, also the San Diego Unified School District, the nurses. We work a lot with the nurses from those districts. We also have the universities and colleges in town, and we work with their student health services as well. So any way that we can continue our education from high school to community colleges on through college and beyond is really helpful to us. And as part of the recommendations that are associated with our county TB elimination initiative, we have 6 of them, but I've highlighted number 2, and this is what we're working on right now in partnership on behalf actually of the TB elimination initiative. And that's promote awareness of LTBI as a major public health concern, which is preventable and curable. And as I said before, we are looking to educate those 175,000 people that are estimated to be living in San Diego County with latent TB infection. And with that recommendation, we are looking for doing effective outreach, which is essential to TB prevention. And one of those activities is what we're introducing today, training teen peer educators as TB outreach specialists that will promote TB prevention to be important for San Diego County to reach TB elimination goals. And with that, I'm going to hand it over to my colleague, Yolanda Lopez, and she'll talk more about the TB Peer Educator Program.
Well, hello everybody. My name is Yolanda Lopez, and like Marty says, I do work for Tuberculosis Control Program for the County of San Diego. Sonia, thank you for having me today. And again, Sonia just said it, we will answer any questions that you have about TB at the end of this session. And let me introduce you the TB peer education role in TB elimination. Next, Marty, please. We just want to present this opportunity to you in case you are interested and you want to apply. There's, with funding from County of San Diego Health and Human Services, the San Diego County Office of Education will offer mini grants this year to some public schools to implement health education in grades K to 12. If you are interested, just contact Paige Metz at the San Diego County Office of Education. She will have more information for you. Opening applications for this funding are going to be in December. Next, Marty. What we can do? We can train students as TB peer educators. We can create high school health pathway programs. TB peer educations can be a standalone program or combined with COVID or any other communicable disease education. Create a TB peer education curriculum. Train students to be TB peer educators. Training students as TB peer educators that will promote TB prevention and will educate their peers is very important for San Diego County to reach our TB elimination goals. These students can promote TB prevention messaging, education, and distribute materials as part of school and community activities. Next. This is just some examples of what we can create, the TB 101 curriculum components. We can go through what is TB, how it's spread, how it's preventable, and it's very important community resources available to know your TB status. It is very important that a person knows their TB status so they can make healthy choices for them and their families. Always their families, that is very important for everybody who has TB to stop the spread of the disease within their families. So it's very important to know your TB status. Next, Marty. How can we support you? Train peer educators on TB and how to prevent it. We can do that. We can provide technical assistance on how to set up a TB prevention program and how to promote it at your school. We can offer certificates of training completion both for your health pathway program and each TB peer educator. And we can be a communicable disease prevention partner with your school and assist with TB outreach and education in your extended community. I have worked with several times, I have worked with high school students, and they're really creative with the TB messages in their campus. So it'd be very nice, a good opportunity for all these kids to learn a little bit more about tuberculosis, and for me to extend my training to these kids. So having said that, next, Marty, if you have any questions, we're open. Marty and I are open for questions right now. And if you need any TB trainings, you can contact me at yolanda.lopez@stcounty.ca.gov, or you can call me and I can be more than happy to come and do a training for you and your students. Thank you very much. Any questions?
I have a question about the peer educator program. So do you anticipate that this will be an ongoing program or like a short project that has like a start and an end? Or does every school have a choice, an option?
Sure. What we're looking at is like a 6-week training of the students and then ending it with a project. So it's almost project-based, curriculum segment. And so we can go in, we can do the training, and then they can end with a project where they go out and present to their peers at their school. And, and of course, students are so creative, they'll come up with ways of how to do it. And then it can continue on. What we picture is also there are health clubs on campus, and then it could be folded into there as far as activities that they can do, or they can combine it with other, disease outreach programs as well. It can be in part of a health fair or something like that, where it just keeps circulating. And then we're always available to come out in, the next school year with more students to be able to do this. Another pitch I want to do with this program, I don't know about you. I have a high school student right now. I've worked with high school students in being mentors to people that are looking, for students that are looking to get community service experience for their college applications. This is an excellent program that we can offer to where not only can they are able to do outreach at their school, but there's also the possibilities for them joining us with community events within where they live as we do TB risk assessments and testing and hopefully treatment out in these high-risk TB communities.
So we can definitely help you out with that. Getting you out there to train the educators and the students to get this program kicked off. So that's something that you need me to do. We can just do what we've been doing the past previous years, but except it will be for the peer education program. So just let me know how you want to move forward with that. And then also, do we know how much the mini grants are? Like, is there a certain amount of funding?
That is a question for Paige Metz's office to answer. I don't know the ceiling as far as how much is available. But I do know it's quite a bit of money that's being offered. So I don't know the breakdown right now, but the RFP is going out in December. And you will see tuberculosis as part of that RFP as far as communicable diseases, including tuberculosis. So when you see that, think of us and contact us, and we'll be happy to be the technical advisors there in if you're writing up a mini grant, what you should be writing within that to make it a competitive proposal.
Okay, that's good to know. Are there any other questions? Okay, so let me just display I think I can override, yeah. Let me display the.
Would you like me to stop share?
No, you don't have to. I think I can actually just override it. Let me pull my screen up. There we go. And there we go. So you can take a screenshot of this